Welcome to the Paws Effect podcast. I am your host, Dr. Carra, and I am very excited to welcome Desiree Rees to the podcast this morning. And we're going to be talking general mental health and her business, Human Co. So welcome.
Thank you, Carra. It's a privilege to be here, and thanks to everyone who's created the opportunity for me to come and share today. It's a privilege to share my passion, particularly around pets and vets, all things that are to do with home. Yeah, thank you.
No, thank you so much. So let's start off first. Introduce yourself. Give us a bit of background.
Yeah, so I have been in the veterinary profession for over 17 years. For my sins, I married my neighbour who was studying to become a medicine specialist. So I spent the first 6 years of married life up at Onderstepoort, walking the halls with the students, sitting in lecture halls because that was the only way I got to spend time with my new husband. We then decided to have 2 children whilst he was doing his residency. But it was an awesome opportunity to get to know I think, and understand the veterinary profession from the baseline, from the student level. And then we moved back to KZN and opened a specialist practice and had 2 veterinary retail outlets. And it was in employing staff that we realized, with my background being psychology and communications, that there was a huge skills deficiency within the profession. And so somebody said to me, well, do something about it. So I did. And I started doing congresses and talks and CPD events to try and upskill vets and nurses so that they had better people development skills. So how to handle the people that they work with, how to handle clients, how to handle staff, sometimes just how to handle themselves. And so that's where Human Co started. Well, for me, it was where my consulting started, and I did that part-time for a long time. It's been only in the last 2 years that I've been able to do it full-time, which has been a privilege for me. So it's my heart is to see people grow. My heart is particularly in the veterinary profession because it's such a special profession. And I think that there are a lot of challenges that have not been met. And I also get the privilege of going back to the university now and lecturing undergraduate students and going into practices and offering consultation to practices who are struggling maybe with staff members or community conflict management with each other. You know, very often we get put into these high pressurized situations, but we don't necessarily know how to deal with different personality types. And we all come from different backgrounds and different experiences, and those always don't land well. So it's just about tweaking a skill set, just like vets learn how to become amazing at healing the animal body. They can also learn how to communicate effectively to get results that they need out of people and to make their teams work better. So that's where I come in and hopefully make a difference to the teams and to the practices across South Africa.
And individuals within those teams.
Yeah, and individuals.
And why is this important? So from a business perspective, you know.
Yeah. So at the end of the day, the main focus of any practice is to make sure that that patient walks out healthy. And if our vets are not healthy and our teams are not healthy, then they cannot provide that service to their patients. And so that really is the crux of it, is the heart of every practice. If you go and look at the mission statement, the vision statement of practices, it's always rotates around providing a service to their patients. But we have to, it's like doctor, heal thyself. You've got to be able to be okay in you before you can provide a care, because there's a limit to how much you can expend before you burn out and you suffer yourself. So it's important that the teams function well with each other, because it takes not one person to heal a patient, it takes a team to heal a patient, and that team has to be able to communicate effectively with each other in order to get that patient to the place it needs to, where it can go home with its owner. And then there's also the owners who need to be communicated with. The more they understand, for me, one of the biggest communication issues we have in veterinary practices is the stance of where the vet stands, where they sit with 6-7 years worth of medical experience and verbal jargon, and the owner who has come off the streets layman and has no medical jargon. And now we have to close the chasm between their understanding of what's wrong with their pet, because they have to make the decision and they also have to pay for that. So the more they understand about what's going on, the more likely they are to be compliant with treatment at home, but also to pay the bill at the end of the day. And so that's how we can ensure that the communication is as close as possible, is making sure that the owner understands what it is the vet is saying and what is actually wrong with their pet, so that they can take better ownership of their pet.
So is it an awareness issue or is it a communication issue? So like going into veterinary practices, let's start with how is it different to a normal every other day job or an accountant or a dentist? How do vets differ in terms of the stresses and strains on them within the profession?
I think so for me, it's and not. So they're not much different from any other profession because they're human.
Yeah.
So we all suffer from the same condition of being human.
Yes.
So we all mess up. We all make mistakes. I think the thing is, in the veterinary profession and practice, there's this severe pressure that you're not allowed to. I'm not allowed to mess up.
But you also got lives at risk.
Yeah,
don't you?
that's
so
it.
Mistakes are.
So that's the thing, is I'm not allowed to not get this right. I'm not allowed to not know what's going on. And so the pressure to perform and the pressure to get it right every single time is much higher than somebody who's maybe working as an accountant and makes a bit of a mistake on the books. Oh, not a big deal. We can sort that out and do some shifts and changes. The pressure on a vet is, if I don't get this right, this patient might not live. And so that's the outcome is different for them. And I think that we are having to try and normalize making mistakes within a certain degree in an area, particularly with our younger vets. They need to know that they are learning as they grow, and that's why mentorship is so important. You know, we're needing to see practices that have and allow older, more experienced vets to mentor their younger vets to create opportunity for growth and mitigate mistakes, you know. But yeah, we do need to normalize some of the aspects of being human, just so that vets can function normally. Otherwise, the pressure becomes too much.
So it's providing a framework of support, from mentorship to the ability to admit and deal with mistakes.
Deal with mistakes, yes. And then what do we do? You know,
and learn from them.
Yes,
absolutely.
Yeah, that's it. Yeah, if it's a pattern, we've got a problem. But I think in essence, you know, is just normalizing the fact that we are under a lot of stress. They are under a lot of stress. There is a lot of pressure. And so what do we do when we're in that space? A lot of stress in the practice. One thing we've got to remember about veterinary practice is that it's not once a vet is a year qualified, 3 years qualified, 5 years qualified, then they will not feel the stress. They're always going to feel the stress. It's a stressful profession, period. The
is it cumulative?
I think well, yeah, it does it.
Is that why they suffer from compassion fatigue and burnout?
Yeah, I think there's a lot of areas that contribute to that in particular. So one is, statistically, they actually decrease in compassion fatigue and burnout the older they get.
Okay.
So then the theory there is, have you learned a coping mechanism? Have you become hard, or have you numbed out? Like, what is it, you know?
Absolutely.
So I think what happens is we've got to have realistic expectation. Realistic expectation, I've chosen a profession that is stressful. So what do? I create resources and I have coping mechanisms to manage that, not try and change the stress. You're never going to change the stress, but you can manage yourself. So this is about equipping myself to be able, it's like going through the valley of the shadow of death or through a fiery valley. You're going to have arrows fired at you. If you go in there going, oh, I'm not going to get shot down, then you're going to get shot down and it's going to hurt really badly. But if you go, oh, I'm going through, you know, a valley and it's got lots of fiery arrows, let me put some armor on, then when the arrows do come, you're not going to get taken out. You're going to maybe, you know, shift a little, but you're going to be strong enough to walk through till the end.
And understand that this is just a day.
That's
and
it.
it will pass.
Yeah. And what do I do when I'm having a tough day? What do I do when I'm having a bad vet day? You know, what do I do when I have a really grumpy, ugly owner standing in front of me when I've done everything I possibly can to save this patient and it's still not good enough? And the reason being is it's a biological being. There are no guarantees or conditions that come with this pet. So it's hard. It is hard.
And I think all team members, from assistants to receptionists and vets and nurses, they all suffer from the same.
Exactly. So it's not just the vet. And I mean, you've hit on something really imperative, is that team aspect to a practice. Is the first encounter an owner has when they make contact with our practice is actually the person either online your online presence, or the person at the end of a telephone making that appointment for you. And so that person, that receptionist, is just as important as the vet at the back who's going to be, making the diagnostic or making decisions about what needs to happen, to the kennel assistants who's holding your pet while they're getting the blood drawn or having the gel coat put in. So the team effort, I really believe that a practice is only as powerful as the team that is around it. If you want to look at successful teams, successful practices, firstly, my biggest one is look at the leadership. So we see a lot of practices who have closed or are dysfunctional due to a lack of leadership. So vets who refuse to put the leadership cap on, acknowledge that they actually have to take some responsibility for the direction of their business. They can't just rock up and treat patients.
Work as an individual.
And then the second one is the toxic aspect to veterinary practice, which is fascinating in that, I've had many discussions with different groups of people outside of the veterinary profession, within the veterinary profession. Why does it feel like we have such a toxic environment in the veterinary profession? I don't know if it's a certain personality type that is attracted to the veterinary industry. Is it just because of the high pressure status? Is it we were never actually taught coping mechanisms and communication skills? So now we throw all these people together and there's no rules, there's no modeling, there's no stabilizing.
Clear boundaries in terms of
clear boundaries.
Not tolerating toxic behavior.
Yeah, and then coupled with we don't, the client is always right. So I also believe we need to be putting boundaries out with our owners as well. This is how you can behave in our practice. This is what you are not allowed. You don't get to swear and shout at our staff. You don't get to, in your anger and in your emotional state, take it out on the people who are doing the best they can to provide treatment for your pet. So there's a lot to learn. I think we've got lots of areas of growing.
Yeah, lots of areas of growth and potential. And now, a word from our amazing sponsors who make the Paws Effect podcast possible. To make a promise implies trust. To make a pledge creates expectation. And to make a commitment initiates responsibility. For more than 25 years, we have made it our mission to take the ifs, buts, and maybes out of premium pet food. That's why our experts put the best science behind our food, so your pet's health is put first. That's why, when you seek value, we strive to give you more, like protecting your pets with our free accident benefits. And when you need great tasting food, our fresh meat taste delivers. You see, what sets us apart is not one thing, it's all these things combined. Because we understand that when it comes to your pet's health, you don't want doubt and uncertainty. You want absolutes, the absolute best given your means, like premium veterinary quality food of real value that doesn't cost an arm and a paw. So rest assured that any claim we make, we stand by. It's our commitment to your pets and our promise to you. In fact, we're so confident in what we stand for that we have made the ultimate promise to you. It's called the Ultra Pet Promise. 100% money-back guarantee, a no ifs, no buts, and no maybes kind of promise. We call it our satisfaction guarantee. Welcome back to Just for Pets. You're with Dr. Carra.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Gets it all to your door.
Let's get back to our conversation on the Paws Effect podcast. So you come in with a fairly holistic approach from setting up that leadership role and the expectations, obviously, in a position of being able to supply the time and funding for it. But you help all staff, and then you help teams become more cohesive. Is that correct?
Yeah.
And so what's the structure of that? How do you, is it just education? Is it team building exercises? Is it individual tools? Obviously, I know you work as a personal coach as well. You know, how do you tackle it from all angles? What's the best approach?
So I've had to go through what I have felt works with my experience of being in the profession, it's been an interesting journey, because what works for some industries definitely does not work for the veterinary profession. So it's been trial and error as we've gone through. But for me, the biggest, if you want to have, so for me personally, as in my passion in human co-coming, my biggest thing is connection, is the human connection, and that translates in a veterinary practice to like the human-animal bond connection. So that's what the vet's part is creating that closeness with owners and their pets. But for me, it's the people and the practice. And then the second one is development. And so the biggest way for development to happen is behavior change. And for me, there's a few aspects on that. The first one is the coaching, which is the one-on-one. So we all come with our stuff because we're human. And it lands in our work environments, wherever we may be. And so I love doing work with people one-on-one, where they're at, how they see themselves in their space, how they land in their space, how they can be better in their space and the practice. And so coaching has that aspect. I also provide recently trauma and crisis counseling now, because I'm seeing more and more of that coming through in the lives of the vets. And reason being is very often we have more than one thing going on in our lives. And for a vet, it may be that really ugly owner that triggers it for them. It might be that patient that they spent months working with and then it dies tragically, and that leaves a scar or a difficulty. It may be the family aspect of what they're dealing with at home, and now they've got to come to work and they're being pushed emotionally and they're being put under a lot of stress, and so my coping or my threshold is not as strong as it used to be. And so it's working with people where they're at. And then so that's the one-on-one, that's the connection. Then the development side is coming into a team and actually giving them the skills and the resources to be able to have the correct boundaries, the correct communication, the correct conflict management. So it's all those interpersonal skills. And we are not taught that.
No.
It's not, and every family deals with things differently. So we all come with our different backgrounds of what we think is normal, throw it into a high pressure cooker, and then you want to see things explode. And so it's about going into practices and going, right, let's establish what our family, our practice family, how are we going to do things? What is going to be acceptable? What do we want to see?
So it's making agreements within that environment.
Exactly, yeah. And it's almost like contracting with each other about how we're going to arrive each day and be, and how we're going to work with each other, and what are we going to do when you're having a bad day, and what are we going to do if I am grumpy? How are you going to handle me? You know, how are you going to help me get myself back together again when I'm losing it? Because we all need help, right? And we spend 80% of our day with these people. So to ignore the fact that we need conflict management skills, we need communication skills, is almost asking for trouble in our practices. So we have to address those things if we want our teams to move. And I think pressurized with the economy the way it is at the moment, the stresses that our clients are going under. So we've always got to remember that when a client walks into that door, into our practice, they already come with a high level of anxiety. We have no idea how long it got them to get that cat into the cat carrier. We don't know if the dog vomited all over their nice upholstery in their car. We don't know the crying and the screaming that went on in the car while getting to the vet, and now trying to get the dog out of the car. So by the time they land up in the consult room, they're already anticipating drama. They're anxious, they're nervous, they're scared. And so we're already dealing with a highly charged emotional being in front of us. And now we're wanting to, have a conversation with them about the treatment plan of their pets. And sometimes they're not the most reasonable. And so it's also having the skills to deal with that.
So there is possibly still a huge stigma around talking about mental health. And obviously I have to be honest, as a business owner, it's a topic that causes a few grey hairs, because you know that with mental health comes a responsibility. But you can either broach it in, let's try and make this environment better, because happy staff are productive and more likely to sort of commit to your team. But what has happened with the stigma? Is it a buzzword? We know suicide rates in vets is quite a topic of discussion. Let's start with the stigma around
So it's so interesting. 12 years ago, I used to have to go up to the university, and I would need to do a talk on stress, because now, obviously, there was a panel of us that got brought together. We sat with the military, psychologists, professors from the universities. We sat with a whole arrangement of people trying to address the suicide rates in South Africa in particular. And what do we do about it? And everyone was going, we need more awareness around it, more information. And so I thought, great, so I've got the material, and I could not use the word stress. I had to use the word overcoming the overwhelming. The minute I put stress or anxiety, the room emptied. People would get up, and they still do, get up and walk out.
Why?
It is so fascinating. I had the same thing happen last year down in the Western Cape. Get up to do a stress talk, a third of the room left. And I think there is a part of the veterinary profession who feels that they are exempt from that. And then there is another part that is, if I have to hear it, I then have to acknowledge it. And if I acknowledge it, I need to do something about it. And for a lot of us, we feel that we just don't have the energy to deal with it. And so there is a very common coping mechanism that works in the veterinary industry, is where people numb out. And so if I put my head in the sand and I ignore it or I push it down, I almost numb out the emotion, and then I don't have to deal with it. But what actually lands up happening is all those suppressed emotions have to go somewhere, and they erupt up later as a mania episode. And this is where you'll have the meltdowns. You may see it, staff crying uncontrollably. It may even get so bad where people get hospitalized. And we really don't want that happening. The wonderful thing about mental health is that we currently sit with it is probably the most researched, the most educated, the most resourced mental health issue that we have currently in the world, which means that anybody who is struggling with mental health has the ability to come out of it. And I think for me that's one of my most powerful things, is you are going to be okay, but you have to go through the process. You can't not do the process. And so one of the best, I think, what we need to acknowledge within the veterinary profession is know what your flags are. All right, so know what it looks like when I am not doing okay. Know what those flags are on my colleagues, because I am responsible not just for me, but for the people that I work with, and have the difficult conversations. So we're currently producing brochures around depression, anxiety, panic attacks, because we do see quite a lot of panic attacks within the practices, where I actually just get so overwhelmed, my body goes into a stress status, and there is a way to calm that down. But then again, it's also because vets work such long hours, and they often work weekends, and they also have full-time families. We're not seeing them engage in good coping mechanisms. And so the bad and the poor coping mechanisms of varsity life, they're still using in their 40s and 50s.
A good glass of wine at the end of the day.
And I mean, that's just it, right? So when does that extra glass of wine at nighttime, or me binge
over
watching,
exercising,
or the online shopping, or the binge watching, or excessive sleeping, or not sleeping, because we've got to remember sleep is so imperative to mental health. And we very often will see people not sleeping properly, and then I won't go, let me go to the doctor and have a chat to the doc about this, because in essence I'm a doctor, so I should be able to sort this out myself. And so there is a lot of, not everybody feels this way, but there are a lot of people feel that they should be able to fix themselves, because they fix animals, right? So they fix other people's or other biological beings, they should be able to do it. And the reality is, when you're in a mental health state like that, you're not capable of fixing yourself. You actually, your whole body is almost like a survival mode. So you get tunnel vision, which means your ability to look at options becomes limited. And you actually do need external help to show you the resources that will work best for you, and you try them out. So some of the things, when we talk about looking after our mental health, it's very simple. And that's what's almost scary, is that...
Give us some tools.
Yeah, so it is so simple that we look at it and go, it can't be that easy, but it really is that easy. Okay. So I think my favorite one is get out. Get out of the practice, get out of home, go for a walk, go walk around the practice, go walk around the block, take the dogs for a walk, get out. And nature is so important. It's actually the green in nature that is shown to actually equalize and stabilize hormone wavelengths in our brain. It's phenomenal. Oh. That's why just sitting and looking in a park, or going, into the bush or the beach or the mountains is so cathartic and so restoring, is because our bodies are wired for it. The other one is movement. we underestimate, and we're not talking, you don't have to go and sweat it out for 20 minutes 3 times a week. It's just the movement of stretching, the movement of, going out, playing with the kids a little bit, kicking a ball, whatever it is. That movement, again, gets the body stimulating. It can actually lift the endorphins. So you want to almost sometimes trick your body into thinking it's happier than it really is. Watching like Trevor Noah online, just comedians, those kind of things to get you laughing.
Laughter.
Yeah, be around people who make you feel good. The biggest way to combat mental health is human connection. And this is why during COVID it was such an issue, is because we isolated ourselves. When we do go into depression and anxiety, we isolate ourselves because the energy to expend into people becomes too much. It's just easier to go and hide on my couch with Netflix.
Easier not to exercise or get out.
That's right. And so that little bit of effort. So it's the small things that are important, and it's keeping it simple. And then even if I say that list of few things, it feels overwhelming, just choose one. The main thing about getting yourself out of that depressive cycle is do one thing that brings you joy, because then tomorrow it will be easier to do 2. But very often what happens is we look at the whole elephant and we become overwhelmed.
It's too much to take on.
And then focus on what you can control. There's a lot that you can't control, and that's, again, in the veterinary profession, you have no control over what comes through your door every day. And for some people, it creates an element of excitement, and it's nice not to have continuity. For other people, eventually, the unknown can be quite scary all the time. So when you're dealing with one thing that you can control, the one thing you can control is you. And remembering that I can control my decisions, I control my thoughts, I control my behaviors. Doesn't matter what's going on around me, I still have control over that. And so if you can focus just on one of those things, then you have gained success in combating the depressive cycle. And then remembering it's a process. So it's not going to get better tomorrow.
No quick fix.
But you will get better. It has been proven you will get better. It is a treatable condition. We have some beautiful medication that's transition medication that doesn't, a lot of vets say to me, I'm scared to go on meds because I'm scared it's going to take my sharpness away. I need my sharpness to think and to, be able to do dosages and diagnostics, and there's beautiful meds out there that if you speak with your GP are able to assist you to get at least the serotonin and dopamine release, but don't affect your cognitive reasoning or your speed. So it's about having some good conversations, finding good doctors to support you, having good behavioral techniques as well. So it has to be coupled. We can't just take the meds and not do the behavior work, okay? Because you've got to remember, the meds are going to give you the dopamine, but there's still a behavior that can be unhealthy. And so we have to do the work together. But you can do that work in 6 months, 9 months, and you're done. And then you've set yourself up. You've done the growth phase and, the growth mindset in your brain, your body has evolved into a new behavioral setting, and you've set yourself up for life. And then you have your check-ins with a professional every now and then when you need to, because that's normal.
Oh, that's really great advice.
It is. It's good to know this. Okay.
We're going to take a break, and then we'll do part 2, and we'll chat a little bit more about one of the terms that you use, which is empowering yourself.
Awesome.
I love that term.
Okay,
and
great.
I want to unpack that a little bit.
Thanks, Carra.
Thank you. We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Paws Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Paws Effect podcast. But wait, that's not all. The Paws Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Paws Effect podcast, please contact me at drcarra@pawsandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Paws Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.